Hi, my name is Christen Johnson. I am a cardiologist with Arkansas Cardiology, located at Baptist Health in North Little Rock. So I'm originally from South Louisiana, and I completed my undergrad education at Xavier University in New Orleans. I also completed medical school and the entirety of my medical training, including residency and fellowship, with Louisiana State University in New Orleans. As a cardiologist, I specialize in diagnosing and managing cardiovascular conditions. My particular focus is in non-invasive cardiology, which means that I focus on echocardiography, nuclear, and other stress testing modalities, as well as cardiac CT for the diagnosis of those conditions. And as I stated before, I go on to continue to manage those conditions as well. I have particular interest in preventative cardiology, cardio-obstetrics, so pregnancy and cardiovascular diseases, as well as cardio-oncology. So the effects from oncology treatments, radiation, chemotherapy that can also affect the cardiovascular system. So my interest in medicine first came about when I was a senior in high school. I was studying biology, which I already loved and had an interest in, but there were portions of the chapter where there would be a section called clinical vignette. And essentially what it did was tie in those biological principles that I was studying and made it tangible and applied it to people with real medical conditions and how we use the information that we know about biology to essentially treat them and cure them. I found that super interesting and decided, hey, if I can make this something that is tangible and helpful to someone else, then I want to do it. I think it's super important to have a good patient and physician relationships built on trust, and I think it's also important to have joint decision making. That means that I am constantly in talks with my patients, educating them about their medical conditions, but also answering any questions that they may have or addressing any concerns that they may have. And through education, through the use of lifestyle modification, which is very important in cardiovascular health, as well as medications and if needed interventions, then my plan is just to help to optimize them from a cardiovascular standpoint. Outside of work, I really enjoy being entertained. So that means that I enjoy going to theater productions, watching movies. I really enjoy attending concerts and also just traveling with my husband and family. I absolutely find prayer and hope important, and so if my patients also find those things to be important and emphasized in their foundation, I encourage that as well. As far as my patients and their preferences, if they are willing to and they would like for me to pray with them, I'm absolutely happy to do so. It's not something that is encouraged or even allowed in a lot of other places, so being able to practice in a place where that is encouraged, that is very special to me. It's unique, and I can only help think that I've been placed in the right place.